Roberto. Welcome to our episode in QCast.
Oh, thank you very much for inviting me. Looking forward to have a nice conversation with you.
Beauty beyond borders, doctor. Do you think that you have multiple patients coming to Dubai to do the surgery from Europe, from London, from other destinations?
Definitely, yes. I think that I'm in a privileged position because working in Dubai and also keep working in London, where I started back in 1990, I'm in a position to serve and to help my patient in both countries, UK and UAE. And that gives me the possibility to really see the difference between what a patient from the Middle East wants compared to what a patient from Europe wants.
Okay, doctors, they coming to Dubai searching for like a luxury experience or privacy or other procedure that not operating in the other destinations as well.
Yeah, basically, in my experience, patients from Europe, especially from UK, they like to come to Dubai for surgery, for treatments, because they find Dubai a good destination where they can combine a short holiday while improving their own look. And they know about the lifestyle of Dubai, also the luxury that they can find here. But what is important, also the privacy, because they come away from where they live. So they come here where not many people knows about them, so they can relax, they can have a really good time looking after themselves, plus having a proper, also good time, a shorter holiday. But all of that depends also from one important factor. They can come here because Dubai is attractive, yes, but also because they know that there are good healthcare facilities. And what is important, there is also a good practitioner, a good surgeon. They know where to go and to whom they want to be operated, because they come also for the surgeon itself. Otherwise, they just come here only for holiday.
Yes, so they enjoying being here in Dubai and they enjoying the luxury experience. And of course, the amazing doctor as you are, Dr. Roberto.
Yeah, so that's important, because in any field of surgery, they come here because they know that there are good doctors as well.
Yeah, so you think that there is any specific demand on a specific procedure in Dubai?
In Dubai, of course, it's very popular, in my experience, body reshaping. So reshaping the body with liposuction, breast augmentation, fat grafting. These are the most common procedure. And the difference between here and Europe, that for example here they like probably a bigger breast, bigger buttocks, a very small waistline. So that's a little bit different that I had to adapt, and I can see between my practices between Europe and the UAE. So in this way, Dubai is unique and give me the opportunity to do what they want, but following also my concept of beauty. Because at the end of the day, we surgeons are the professional that we have to guide the patient in the right decision. Because the patient may have a request, but sometimes it can be an unrealistic request. So as the doctor, professional surgeons, we need to guide the patient to take the right decision.
So what if the patient actually she didn't listen to your advice and she's insists to do what she's asking you to do for her, even it's not suitable to her case or it will not look good on her body?
So I do this profession for the last 30 years and always kept a proper ethic. And my idea, if the patient wants something that I consider that is not suitable, not correct for the patient, I like to say no. I prefer not to operate the patient with unrealistic expectation, with something that I consider is not good for the patient. I prefer not to do it.
Doctor, as you are practicing now in Dubai and in London since 20 years now, how you can compare this experience with the Dubai patient or Middle East patient and London patient? The kind of procedure they're asking for or the type of demanding procedure, let's say?
Yeah, it's a good question, because having the possibility to work in London and Dubai, London I started long ago in 1990, here in Dubai in 2008, I had the possibility to compare the two different reality between UK and UAE. Nowadays, the two parts are getting closer in terms of demand, because of the high influx of expats from Europe and many from UK. So the two are getting closer in what they want. But at the beginning, yes, there was a much big difference. At the beginning, in London, of course, more facelift, more rejuvenation surgery. Instead, here in Dubai, more beautification surgery to improve the look, not only to rejuvenate. But now that the population in Dubai is getting older, plus the big influx of expats coming here, bringing what they want in UK here, the two practices are getting similar. And at the beginning in Dubai, not many facelift, but now I'm happy to say that also the facelift is getting up together with the body reshaping that is very common here in UAE.
What is the top procedure, doctor, that you are proceeding or operating in Middle East compared to London?
In the Middle East, Dubai specifically, the most common in my practice is body reshaping. Body reshaping, that means to increase the size of the breast, to lift the breast as well, and also breast reduction, together with liposuction to make the body contouring smaller, and also to increase the size of the buttocks. In London, instead, one of the most common procedures is facial rejuvenation, to rejuvenate. Plus, of course, also breast augmentation, but with smaller size of implants compared to what I use here in Dubai. And breast reduction is not as common as here in UAE. So there are still some differences between the two places.
Yes. So this takes us to the next question, doctor. Do you think that social media, it can impact the type of procedure that any patient can ask for, or play a role that the patient will ask for this specific procedure only to follow the trend or to follow a social media blogger or some celebrity?
Social media is very important and nowadays has a big impact in the practice. But social media is important in the younger population. So the patient that come to me in London or in Dubai, the younger patient are influenced by the social media. The middle-aged patient, not much. But social media, yes, has a big impact on the practice. And what I like of social media, that it can give the information. What I don't like about social media, that sometimes give some unrealistic expectation to young patients. And I feel the duty sometimes to guide the young patient to realistic expectation and to do what is good for the patient, not to become a copy of somebody else in social media, because becoming a copy and look like somebody else in social media, that is not a good approach for plastic surgery.
Yes, so I can say at the end, doctor, that from your Italian background, you can very well known doctor in Dubai and London, and actually from your background, you can do the easy symmetric and balance between the Middle East patient and the European patient as well.
Yes, I completely agree with you. I consider myself lucky that I was born in Italy, a country where there is a lot of beauty, fascination for art, beauty again, elegance. So that gave me some good influence in my way of thinking. Because growing up with all of these concept of beauty, aesthetic, yes, brought me to the field of aesthetic plastic surgery, and I think that I have a real pleasure in looking at research for beauty. And that's what I do when I have a body in front of me. It can be the face, the breast. I want to improve what I have there. It's like a canvas. I want to give what is the best for the patient, but in a natural way, respecting some proportion, concept of beauty, without transforming a patient completely. The patient come to me because they want beauty, elegance, in a natural way.
Yes, more beautification, let's say.
Correct, yeah.
Yes.
Beautification and rejuvenation.
So, doctor, do you think that there is any procedure you can operate in Dubai and you cannot operate it in London?
Yeah, definitely yes. So there are some procedures that I can do here much more easily, and I consider myself lucky to be here and to do that. One of the major example of what I can do here, and unfortunately I cannot do in Dubai, cannot do in London, is treatment surgery or treatment using expanded mesenchymal stem cells. That means stem cells that are growing in the laboratory, so that when I do the treatment with the stem cells, I inject millions and millions of stem cells to have the proper clinical result. I do here in Dubai because we have the possibility, the regulation that I can use these stem cells that grow in the laboratory. In UK, I can't because the regulation does not allow us to use freely these expanded stem cells deriving from the laboratory.
Yeah.
So that is a big limitation. In fact, I was last summer in a regenerative congress in London where I presented my personal experience in using expanded mesenchymal stem cells for several indications, from rejuvenation, for fat grafting, and I was using expanded mesenchymal stem cells. So the colleagues that are attending my presentation, they were all very surprised and willing to do the same, but unfortunately they can't.
It's not allowed.
Because they're not allowed because of regulation. So I am lucky to be in Dubai because we are 1 or 2 steps ahead of the other countries.
Yes, let's highlight this part, doctor, about the stem cells. Actually, the audience need to know about more about the stem cells. What kind of procedure you can choose, or what kind of patient you can choose the stem cells as a solution for them?
Stem cells have a lot of indication. Indication that can go from regenerative medicine, can go to orthopedic surgery, gynecology, andrology. So there are a lot of fields where we can use stem cells. In my specific field of aesthetic plastic surgery, I use stem cells for skin rejuvenation. I use stem cells for hair restoration, then to treat scars, stretch marks, and also what is important, to help the fat survival when we do fat grafting, because fat grafting is such a popular procedure here in Dubai, and if I can enrich the fat graft with the stem cells, there is much less fat absorption, so that means that the result will be better and will last longer. So that is something that I can see a big future on that, and one of the future trend for aesthetic plastic surgery.
Yeah, it's more medical than only aesthetic. It can
be of course, the medical aspect that is important, but also in aesthetic plastic surgery is very important as well. And being a plastic surgeon, I like to focus on that. Yeah.
Yes. So do you think that the stem cells, we can consider it one of the future common procedures for the future?
Definitely, yes. Stem cells will be bigger and bigger in the future, but has to be done in the correct way, using the right number of stem cells. You cannot just mix the fat and just say stem cells. There is a bigger science behind, and you need to work with science, not just with marketing tools.
Yes. At what age, doctor, you can consider this patient suitable for the stem cells?
Okay, the stem cells have a curve. So if you age, also the stem cells will decrease the power. So that's why if we can collect and bank the stem cells when the patient is younger, until is 50 or 50s, will be much better. Otherwise, we have to use some allogenic stem cells or from the blood cord stem cells. Because if I see that there is an older patient, then I prefer to use blood cord or allogenic stem cells.
You think it's allowed that if the patient is the son or the father and can borrow from one of the relatives, like a family can borrow their stem cells?
For what we do, no, it doesn't work like that, no. But it works in the terms that there is a possibility to bank some allogenic stem cells from donors that are completely safe, that they don't create any reaction to your body, but they're still working in the matter that helps to improve the health or the rejuvenation of the patient.
So doctor, now, do you see that you can use the stem cells while you are doing the breast augmentation and the fat transfer, which can help that the fat will last more?
Yeah, this is my favorite technique for breast reshaping, and I call it hybrid breast augmentation, because I'm going to use the latest type of breast implants, but a smaller size, and I can enrich that result of the breast augmentation with a fat graft, because a fat graft will give a better cleavage, a better pull, you don't feel the edge of the implant, and then I can enrich this fat grafting with stem cells, so there is much less fat absorption, plus there is also an improvement on the skin of the breast. So that is the top of the technique for breast reshaping. what I call it hybrid breast augmentation using the latest type of breast implants, fat grafting, and stem cells. This is the top that the patient can have for breast reshaping.
This is so impressive, doctor. So, doctor, male versus female,
Yeah.
Dubai versus Europe, or London specifically. What kind of procedure you are choosing for both, or
Yeah, there are some differences between the two cities. Here in Dubai, there are more female patients, and the part of male patient is less. But I can see a trend that also the male surgery is increasing here in Dubai. In London, yes, it's always female, but in my personal practice, I have a good part of men asking for surgery in London because I offer for male surgery, I offer penoplasty, the surgery to increase the size of the penis. So that's why in my practice in London, I have a good part of men as well. In Dubai, this operation is getting now more popular, so I will see that in the future there will be also an increase in the demand for this particular surgery, so the men that will come to the practice asking for surgery. Then, of course, they may start with this particular operation, and then they will ask for liposuction, eyelid surgery, and that is very popular in men as well. Instead of for women in Dubai, body reshaping, breast is still at the top on the list.
yes, for male procedure, actually, you mentioned the menoplasty,
Penoplasty, correct.
As you mentioned, we will go through it in details in our next.
Yes, I will be very happy
session.
to explain because it will take some time.
So, what are the future trend in the cosmetic surgery?
Okay, in aesthetic plastic surgery, the future is big.
Yes.
But I think that, in my opinion, what will be big and what I would like to see is a little bit change in a facelift. Because my personal approach, my idea of facelift is to give a natural facelift, minimizing the aggressiveness of the surgery and a quicker recovery time, minimizing also the risk. So that's why what I like to do and what I think it will be the future is to give a good result, combining several aspects of different techniques for facelift. So what I like to think for the future in my idea that I'm already starting to perform is to do a bespoke facelift, considering like a 3D facelift that combine the traditional plain facelift, pulling up the muscle in a vertical way with a short scar, plus combining also fat grafting to the face, because adding fat grafting during the facelift give that form of 3D dimension that is essential for the proper facial rejuvenation. It's not only to lift the skin deep and the muscle, they will be too flat. I want to do that, yes, but also to give more volume. And in this way, if I add the good aspect of the different techniques of facelift, short scar, vertical lift, fat grafting, stem cells, I think that will be the best way to give the best option to the patient for facial rejuvenation.
And it will help in the recovery time as well.
And the recovery time will be also less dramatic swelling, that my patient, they go back to social life in about 2 weeks.
What about the scar, doctor? Because most of our patients, in case of the facelift procedure, they are afraid about the scar.
But in the way that I do the facelift, the scar are concealed because they just behind the earlobe, then inside the tragus, so no scar here. Then there is a scar around the curve here of the helix, so it's hidden. And then it's hidden in the sideburn, in the hairline. So it's basically minimal scar. And through this small scar, with the right technique and the right instrumentation, I can lift up the muscle, the skin, in the right vector so that we look natural, reshaping the neck, the mid-face, and then completing this job with eyelid surgery is needed, but what is important, giving back the volume to the face with the fat grafting. And if I can use the stem cells as well, I can rejuvenate the skin as well. So it's the full job for the future trend of facelift.
Thank you, doctor.